Hi, my name is Steve Straisman. I'm an Ontario Provincial Police Officer. I have type 1 diabetes, which is my pancreas basically does not work, and I have to take needles every day. To see an endocrinologist when I was posted in Nipigon, I had to drive to Thunder Bay. And it's reassuring for me as a type 1 diabetic who takes personal health care extremely seriously, is to have anywhere in the province that I go, the healthcare team that would be looking after me at that particular location would have access to my records with the click of a mouse.
Having a lab information system that's integrated, that we're having several sources of information coming to one place is a huge advantage.
The patients are going to notice they're not having to duplicate tests, but they're also going to notice they're not being asked the same questions over and over again. Their care providers are more confident about the care that they're delivering because they have better information and they're more comfortable with the decisions they're making.
The Ontario Laboratories Information System and eHealth Ontario have revolutionized my practice over the last year. And in fact, I'm constantly learning new ways to use this system to my patients' advantage.
So before we had online access to OLIS, we would count on the paper copies of results coming. About 20% of the time the paper copy wouldn't be here, so you'd be phoning the lab while the patient's waiting for the result in the exam room. So it was not very efficient.
With a click of a mouse, it's right there. No more extra testing for the patient. No more frustrating, confusing processes that have to take place. Now it's like a central hub of a computer system that is plugged into by all your healthcare teams.
And I think everyone wants to see movement forward in reducing inefficiencies in clinic. Everyone wants to use their time wisely, both patients and providers.
So you can find the correct information quickly, make decisions for the patient, make the correct decisions for the patient, and that's going to improve care.
And it takes away that frustration of inefficiencies within the system. They like to see that it's an efficient system, and they like to see their tax dollars used to create an efficient system.